Okay, it is 10:04, so we're going to go ahead and get started this morning. Just as an informational message, I wanted to let everybody know that today's training is being recorded for internal purposes only and will not be available for the public. We'll go through the objectives that we're going to be covering here, including a live demo in just a moment. First, let me introduce myself. My name is Susan Harrison. I am the field representative for the new Provider Type 93 Substance Use Treatment Centers. And today we're doing an enrollment workshop that will be covering the Clinical Supervisor and Group Enrollment applications. Joining me today is Alyssa Drucker. We are both field representatives with Nevada Medicaid and the Nevada Medicaid trainers. And thank you again for being here this morning. I do recognize that your time is valuable. We'll do our best to make our time together today as meaningful as possible. We are scheduled for 2 hours, which we may or may not need, but we do have that time reserved just in case we have extra questions or we are available to answer any of your questions. Want to let you know that this is a group training, so any questions specific to an application we will not be able to address here today. I wouldn't be able to pull up anything specific to that application during training, so if you do have questions about your Provider Type 93 application, you can go ahead and email me separately. Hopefully everybody here has my email address. You should be seeing on the screen the title slide of today's workshop. We are going to go ahead and go through some engagement tools that we'll be utilizing today. So on my screen now, you should see a picture of a WebEx window. This is what you should be logged into this meeting today. On the bottom middle part of the slide, you'll see in a blue turquoise box, you'll see the option to mute or unmute or start your video. You are not required to be on camera. And then for the mute, unmute, if we ask you to come off mute to either clarify a question, or if we ask you to ask a question, or if you need something, you can go ahead and come off mute using that function there. But please keep your buttons muted for the entire presentation. We will be holding all of the questions to the end, just so that we are not distracted and we can continue and cover all the information that we have to cover today. So we have enabled the Q&A feature within the WebEx window. You'll be able to see that here shortly. Continuing over on the bottom of the WebEx page, you'll see in the dark or like the medium purple, the hand, that is the raise hand feature. If you click that once, that will raise your hand if you have a question that you want me to stop where I'm going through a presentation, a live demo part, and you need something clarified, you can use that feature. The one right next to that is our emoji reaction tool. That's a little smiley face with a plus. It's in the lighter colored purple. We will be using that today just so I can get some engagement from the audience. The orange box to the right of that with the 3 little dots, that is for audio adjustments. If you're having any troubles hearing the meeting, hopefully you won't need to utilize that feature. In the red X, a red circle with the white X and the yellow box around it, that is to leave the meeting at any time. Should you need to step away for a moment, please don't put us on hold. You should just be able to go ahead and leave that meeting, take care of what you need to take care of, and then hopefully have time to join us again. Over to the right of that, you'll see a green box with a little green, it's actually a white S. That's our Slido application. We will be using that today to track our questions. We'll also be using it for a couple of poll engagements that Alyssa will be managing for us. You won't have to do anything separate with that feature. It will just automatically pop up in the WebEx tool, and you'll be able to respond in there anonymously when we ask those questions. And to the far right, you'll see in the red box, that's the chat feature. We did disable that for today. Like I said, we're going to use the Q&A feature that you can ask all of your questions throughout the training, and we'll be addressing those at the end. Okay, let's see. We're going to go ahead and practice before we move on, just to make sure everybody can access these features. If you could use that reaction tool at the bottom and give me a smiley face letting me know that you're ready to move forward. Great, thank you so much. Before we hit our objectives, I do want to let you know at the end of today's training, we will be posting one last Slido question. This is for the feedback that we want to get from you for how today went. Any anything that you want to see in the future, and it just kind of helps us improve our training program by getting your responses. They are very important to us. So we'll ask for that feedback before we let you go today. All right, so the objectives we're going to be covering today, we have a lot of information to cover, like I mentioned. We are going to be going through and understanding how to enroll as a Provider Type 93. That includes a live demo of the online application for that new provider type, determining the order of enrollment, how to locate contact information for Nevada Medicaid, and then, like I mentioned, completing that provider survey at the end. So what is happening and why? So what is happening is our new Provider Type 93, that's our substance use treatment, was created, which will then, it will replace and has replaced the 17215 and 17171 provider types and specialties. Those specialties are no longer accessible through the application process, so you are going to be required to enroll as a Provider Type 93 if you want to continue to get reimbursement from Nevada Medicaid. That application went live yesterday, so hopefully there's been some people out there that have been able to experiment with that, hopefully getting through some of the pages there. Like I said, we can't address questions today, but we're going to go through that live demo so you can see where the changes are. We did post a couple of web announcements, web announcement 3362, which I can't post in the chat because that's been disabled, but if you haven't received that email blast from me, web announcement 3362 does explain what the Provider Type 93 is intended for. And it's actually so that we can do data collection, improve our data collection for reporting purposes to the Center of Medicare and Medicaid Services, or CMS. And that is a requirement for the DHCFP's 1115 demonstration waiver. The new PT93 was structured to require individual enrollments and linkage for the new specialties that were created under the Provider Type 93. So you will have to enroll individuals, unlike how you did it under the 17215. You'll have to enroll any individual provider who is performing or rendering those substance use services. You'll have a group enrollment, and then you'll have those individuals that will be required to link. We have web announcement 3375 that provides additional training dates for the Provider Type 93 for the month of July, and we'll continue doing these frequently while we get through the enrollment process. We will be going into the prior authorization process and claims process or billing processes here a little bit later on down the road after we start seeing some enrollments coming through. So please keep watch for those web announcements for those additional training dates and training workshops. Do want to let you know that you will have access to your current contract as a 17215 or 171 until you are fully enrolled as a Provider Type 93. You'll continue to provide and bill services under that current contract until you are enrolled as a Provider Type 93, and your 17215 or 171 will be end dated, so you won't be doing anything prospectively under those two provider types once you are enrolled as a 93. All right, so wanted to let you know the transition period to become enrolled for a Provider Type 93 is going to go through the end of March 2025. So we expect all providers who are planning to be reimbursed by Nevada Medicaid to be fully enrolled and functioning as a agency with the individuals linked to your group by later than March 31st of 2025. Okay, so now these are the new specialties and provider types that were provider type specialties that were created under Provider Type 93. So we have the individuals on the left and the group is on the right. So for your individuals, you have your CADCs or Certified Alcohol and Drug Counselors. 702 is your Licensed Alcohol and Drug Counselor. Then you have your 2 interns. We have Peer Recovery Support Specialists, and then a Licensed Certified Alcohol and Drug Counselor as the last one there on the left. For your groups, 704 is the new group specialty for substance use treatment in an IMD. 707 is going to be equivalent to the current 17215. So if you're enrolled as a 17215, 707 is probably the one you will want to choose. That is for our substance use treatment clinic. So that allows for level 1 outpatient, level 1 ASAM, level of care services, up through the level 2.5, I believe it is. And then 708 group specialty is for your opioid treatment program, which is equivalent to our current provider type 17171. All right. We are going to talk about some important dates here. Yesterday was the go live date for provider type 93. So that application was open for providers to start that enrollment process as of yesterday. And then again, that application period is going to go through March 31st of 2025. Okay, we're going to take a moment here to have Alyssa launch our first Slido question. So Alyssa, if you could please launch that for me.
All right, you should be seeing the Slido open up within the WebEx application, and we are asking, is the group or agency's clinical supervisor already enrolled as another provider type? Please answer yes, no, or not sure.
And while everybody's answering that question, I do want to take a brief moment to introduce Beth Scott. She is from the DHCFP. She is the policy specialist for the provider type 93 and MAT services program and the demonstration waiver. So I just wanted to take a moment and introduce her. Welcome, Beth. Thank you very much for being here today. It looks like we still have a couple of providers who haven't answered the survey yet. Keep in mind these that we ask are anonymous, so nobody will see your responses except for you'll just see them as a result here on my screen that I'm sharing. We'll give it another moment here. It looks like it's slowing down a little bit. So it looks like 69% say that their clinical supervisor is currently already enrolled as another provider type. 29% is not sure, and 6% say no. Well, good thing for today is that we are going to go through a clinical supervisor application. That is the first and foremost thing that you want to make sure is happening in the enrollment order. So we're going to cover that here. So if your clinical supervisor is currently enrolled, you're going to follow the steps in the yes column on the left. And if they are not, you're going to follow the order in the no column on the right. So if your clinical supervisor is enrolled, you're going to start with your group application. You do have to have one enrolled provider that can link to a provider type 93 group when you submit that group application. Your clinical supervisor is also going to be key when you are enrolling each individual separately that will be linking to the group, because those interns must report their clinical supervisor on their application. So we will go through that here in just a few moments. You can see here are the list of provider types and specialties that can link to a provider type 93 group. The ones that are in bold can also function as the agency clinical supervisor. So we do recommend that the enrollment order goes as we are going to present today. You are able to enroll those individuals and bypass the group linkage requirement. As far as the individual interns or individuals that are going to be linking to the group. The only consequence with that is if a provider type 93 is enrolling, they are required to link to a provider type 93 group. If the individual is enrolled before the group and they're not linked to that group, they will receive a notification letter that tells them that they have 60 days to link to that group. Otherwise, their contract with Nevada Medicaid will be terminated. So they'll also receive that termination notice if the system has went through and verified that the group linkage has not occurred. That provider will be terminated, and you'd have to start the enrollment process over. Just want to take a quick pause here so everybody can kind of soak in what we've talked about. Reminder to put those questions in the Q&A feature so we can address all of those at the end. Okay, so how do we get through this transition? Well, these workshops are here to help you, here to support you. I'm available via email. We'll also provide some additional contact information at the end of the slides. Going into the Absorb provider training registration website, we do have the month of July's substance use training workshops posted there. And again, we'll be hosting these throughout the next few months, probably reducing the frequency numbers as we move forward, but we will be hosting enrollment workshops, prior authorization workshops, and claims workshops as we go through the transition period. Okay, I know we talked about those important dates just a few moments ago. And with that being said, Alyssa, can you launch our next Slido engagement question?
Absolutely. You should be seeing Slido opening up within your WebEx application, and we want to ask, or we are asking, when am I required to enroll as a provider type 93? You can select more than one option. Please select all that apply here. Prior to March 31st, 2025, starting July 1st, 2024.
Looks like it's starting to slow down a little bit here. Just so we are all aware, the answers A and B are both correct. So there is no wrong answers here. The starting date for the application to go live was, of course, yesterday, and then the transition period goes through March 31st of 2025. So now we are going to go ahead and go out to the online provider enrollment portal. That's where you're going to start your new provider type 93 applications. But before we do that, I want to take you out to the enrollment checklist because there are new checklists for provider type 93. If you haven't had a chance to review those, I think it's really important that you do look those over, make sure you know which specialty you're going to be enrolling in as a group and which specialty you'll be enrolling your individuals that are operating within your group and will be linking to your group. So from the homepage from Nevada Medicaid, we hover over the word providers and select provider enrollment. And from the provider enrollment page, you can access the online provider enrollment portal by clicking this link here in the top box. You can click it. That'll take you out to that online provider enrollment page where you start that application. You can also access that from the featured links over on the left under the online provider enrollment link here. Moving down to the required enrollment documents, the second hyperlink is the enrollment checklist. If you click on that hyperlink and go out to the provider type 93, which is all the way at the bottom, apologize for the scrolling. And mine's purple because, as you can see, I've been there before. It usually is blue unless you've visited that site. So if I click on the 93, that's going to list all of the specialties under the provider type 93, which would be equivalent to what we saw on that slide. So we have our individual applications up here. And starting with 704, that's your IMD for residential. Then we have another intern, individual. Then our substance use clinic, which is your 17215. Your opioid treatment program, or OTP program, which is your 17171. And then finally, your individual licensed clinical alcohol and drug counselor. So you need to pick the appropriate checklist, fill that checklist out. It does require original signatures and initials. That enrollment checklist completed will need to be attached to that new provider enrollment application. So make sure you have all of the documents that are listed on these checklists. I'm going to go ahead and open up one just so that we can kind of go over it so you can see what the content is. And I'm just picking the 17215. Hopefully everybody can see this okay. It shouldn't look too different than what you were already doing for the 17215. The only difference is some of these attachments that are listed here were are still embedded within the application, but we listed them here so you could have those prepared and ready rather than going through the application, downloading the document from that page, getting a signature and uploading it. We kind of tried to list it all here to make it a little bit easier for having everything ready to go at your fingertips when you're ready to start the application. So here you're going to be checking these off as they are applicable to what you're attaching. Then at the very bottom here, you can see where we're asking for the ASAM levels of care to where you are SAPTA certified to provide this. So if you're certified as ASAM level of care 1, you would check 710. If you're certified for 2.1 or 2.5, you're going to check the appropriate boxes as you go on down through the enrollment checklist. And there's some little tidbits of information, some important information nuggets. One of our other field reps likes to say that, listed here under the notes. And then for the group, you're going to have your clinical supervisor of the agency's name, title. You'll need their signature, original signature, no text, no using Adobe font or what have you. It has to be an original pen to paper signature, just like all of our other signatures are required on the enrollment documentation. And then the signature of the owner. So that's what a 17215 currently are moving to the 93707 specialty. That's what that new checklist looks like. It might seem a little bit cumbersome at first, but I think it'll make sense once you start going through and reading the required attachments. So that's your enrollment checklist. Go back to the provider enrollment page so we can talk about some other information that is going to be required that is new. Since you will be starting the application over, you will be required to attach an electronic funds transfer EFT authorization form. You can download that here. It's the last hyperlink on this required enrollment document section. So you'll need that as well as a voided check or bank letter validating those financial institution numbers because it will be required on that application. You cannot bypass it on a brand new application. And then last in this section, moving up a little bit, is the associated providers list for Nevada Medicaid. And I believe that we might have a question. Alyssa?
Heather, you did have your hand up, but I know you lowered it. Did you have a specific question?
Yes, I just wanted to ask, can you check all ASAM level of cares in the provider 93707 checklist?
Except for the ASAM level of care 3, that's meant for the specialty 704.
Okay, perfect. Thank you.
And if I said that wrong, Beth, can you please correct me?
Thank you, Susan. Yes, that is correct. If underneath the organization chart that was listed online for the public workshop, hold on a second, I'm pulling that up for reference just to make sure that I'm talking to it correctly. 707 can provide ASAM level 1, 2, and 3. So it would be the specialty 707, 711, 712, and 713.
Okay. So then I said it wrong. So then they can provide ASAM level of care 3 under the 707 specialties.
That is correct, as long as they have the SAPTA certification.
Okay.
You
Does that
guys
answer
are
your question?
amazing.
Okay.
Yes, ma'am, it does. Thank you.
You
All
bet. Thank you, Beth.
My pleasure.
Okay, and so the last document that I wanted to bring your attention to is the Associated Providers List for the Nevada Medicaid Provider Group Enrollment application. This is where you're going to list those individuals that are going to link to your group. Some of you probably are very familiar with this list already if you have multiple provider types. It is very common for the provider type 14. You will list the group information at the top, and then each individual provider that's linking will have to sign off that they are approving the linkage, and so that's what the intent of this form is. You can do it a couple ways. You can either have one master list where everybody signs the same form, or you can have one individual signature page for each one of those providers linking to your group, which may be a little bit easier to manage depending on when people come and go. It's just less copying and scanning and uploading and making the document less easy to read. So you can do it however you want to. We'll accept both. All right, so that does it for the enrollment page of the Medicaid website. So I'm going to go ahead and navigate out to the OPE or online provider enrollment page. We will be using our training environment, so all the information that you see here is de-identified. Does not contain any PII. And we are going to create in our situation today, my clinical supervisor is not enrolled. So I'm going to create that first application for my clinical supervisor. For those of you who said, I should back up just a minute here, one moment. Those of you who said no or not sure about your clinical supervisor being enrolled, I wanted to a feature that you can check to see if that person is enrolled and has an active enrollment with Nevada Medicaid. A couple of different ways. You can either search on the revalidation report, which is posted on the provider enrollment page here, and you can open up that revalidation report and search for their NPI. If they appear on the list, they are currently enrolled with Medicaid, or you can use the search provider feature here on the left under featured links. Here you can search for providers by name, by location, by category, and this will kind of help if you have somebody you're not sure. You can just key in their last name and their first name and then do a search, and it'll bring up any provider that is enrolled under that name. So I'm just going to search for somebody who's in mental health outpatient. You leave your specialty field blank. I'm just going to do Wilson just because it's a common name and change my results to 100. I don't know if anybody uses this feature, but it's very helpful to find out if providers are enrolled. And this is only bringing up mental health professionals. So it will show you a list of those individuals that are currently enrolled as a mental health provider. It'll give you their specialty, their NPI. So that would be a helpful tool for you if you're not sure. Okay, so going back to my provider enrollment application, my clinical supervisor is not currently enrolled, so we're going to create that application for her. And I know that this is very familiar to all of you. I just want to kind of go through some of the changes. So the enrollment type, we're doing an individual today. Clinical supervisor is first in our order of enrollment. Our provider type is going to be 93. That's new. Our specialty is going to give us a list of those drop-down features of those new PT93 specialties. And I know that a CADC or an LADC or LCADC can operate as the clinical supervisor. So I will just choose this one, and then I'm going to add. Here, where it asks about the group association, you are able to bypass this and say no, even though the verbiage up here says that you should be linking to a group. The system is allowing you to bypass this linkage requirement. Again, keep in mind, if that's the case and you're enrolling as provider type 93, you're going to get that notice that says you have linked to your group. So if you bypass this because your group is not enrolled, you're going to need to make sure that that group links you within that 60-day period. Okay. entering in some information here. You can see the billing type is not an accessible field. It is hard-coded to where anybody linking to anybody who's a provider type 93 individual is going to be classified as a performer only. They cannot be a biller and a performer. They cannot be a biller. They are only classified as a performer, so they can only provide services. You don't have the option to change that, even though you're not linking to a group in this particular situation. If I were to say yes, it's still going to be the same thing. You're still going to only be able to be a performer. Okay. And all of the other fields are going to be the same here. All right, so I'll do an address really quick here. All right, so this next page, the provider identification page, is where you're going to also see some changes. You'll enter in the information as you need it up here. And then the license certification section, we do have some new additions here where we've added the BHCQC license as an option for the board. I don't think you could see that before. And then also you can see your SAP certification options here. Mine is not listed specifically for this particular person. So you'll add as many licenses that is applicable to your particular individuals or groups entity. And then you'll choose your individual provider or sole proprietorship, depending on how that individual is classified. And then you'll see the Secretary of State information is not required to be entered. Answer the required questions here. And after you enter your taxonomy codes is where you're going to see this new panel. So let me just add in a taxonomy code really quick here. And now you see down below there's an intern information panel. This is not required for anybody who can operate as a clinical supervisor with the agency. So my clinical supervisor can bypass this panel unless they know that they have an enrolled intern that they are supervising that they need to list. If that's the case, they would want to populate these fields. But your individual intern must be enrolled in order to be listed here on this page. So we can bypass this for today. We're going to. So those are the main changes as far as the individuals are going to go. The clinical supervisor will see that intern panel. The interns will see a supervisor panel, which we'll cover here shortly. I do want to let you know that EFT is going to be required again for the groups. We're not going to say it's required here. We're just going to say she's going to be paid. So we can bypass that. And all of the other pages are exactly the same as what we currently have for our online application. So we won't go through all of those. And the next one I want to cover is our group application. You can start that once your clinical supervisor is enrolled. I do happen to have a example clinical supervisor that is currently enrolled, so I'm just going to resume enrollment here. For the group enrollments, you're going to want to make sure that you choose that provider type 93 and group up here at the top. In the specialty fields, here's where you can select which group specialty you would like to be. So you've got, oh, let me remove these. Hold on here, just 1 second. Remove these and start over. It's important to note here that when you're doing your group enrollment, if you choose to be more than one specialty, like a substance use treatment clinic and a opioid treatment program clinic, you can only do one specialty per application. So if I chose the substance use treatment clinic as my specialty, the next option that I get to choose from is the ASAM levels of care. I don't get to choose those same specialties. I would be choosing my level of care here as to what services I can provide. And you can choose multiple of these. So in this situation, we're going to do level 1 and level 2.1 under our primary specialty of substance use treatment clinic. And then here you have the option to do biller or both. I always recommend that you do both. And then we're going to continue on until we hit the associated providers section. Everything else on these screens is the same. You're already familiar with. You can enter all of your licensure, your SAPTA certifications, your DPBH if you have funding from them. Enter all of that information here in the license section. Enter your business ID information. And then next is going to be the associated provider. This will be new for you. This search feature up here is if you have pages and pages of NPIs that are linked to your group, you can search for a specific NPI instead of having to scroll through those pages. Search somebody who's enrolled, and to pull them in, you do have to manually enter them by clicking on this plus button here, adding their NPI, last and first name, and then clicking on add. I have one enrolled provider that I'm linking to my group. That is my clinical supervisor. So I'm just going to add her at this time. And this will create that linkage between Marsha and our gang, my group. And the EFT, you'll have to go ahead and populate this information like I explained. Attach that EFT authorization form, voided check or bank letter. And then the rest of the screens are all the same as what you're already familiar with. So I'm going to go ahead and cancel out of this. And next we're going to visit an intern application. So again, I already have a temporary one created. And this is for an individual, so this would be after your group gets enrolled. You're going to do your individual interns or your individual other providers that need to be enrolled under provider type 93. That would be the next and third step of the enrollment process. You'll choose your specialty here. You are only able to choose one specialty for the individual applications, so you cannot list multiple specialties here. And then this particular one, I already have a group that's enrolled, so I'm going to say yes here. And I'm going to add my group NPI. And the date that I want the association or affiliation to begin. This application is going to be dated 7/2, so I'm just going to use 7/2 as my affiliation date. And add. And if your group is enrolled, it will appear here. If it's not enrolled, you're going to get an error saying that the NPI is not active, and you would have to select no here and go through the rest of the process, making sure that that group does link the individual, or that letter will be generated, the 60-day letter. Okay. Again, performer is grayed out here, so you don't have the option to change your billing type. Go through the addresses to the provider identification page. Alyssa, do you want me to pause?
Sorry, I did not see that. Heather has her hand up once more.
Okay.
Hi, you guys. Sorry to interrupt. I just want to make sure that, because if we get to the end and maybe the question will be, it won't make sense. So for 707, can you enroll all specialties such as ASAM level of care and substance use treatment clinic in one enrollment?
Yes. So on your 707, 708, and 704, those are your group specialties. Within those specialties, you need to identify as a subspecialty what the ASAM levels of care are that you're SAPTA certified for.
Perfect. So I can do all of them in the one enrollment.
Yes.
Perfect. And then my next question is, for the associated providers in 707, can you add all clinical and medical providers as associated providers?
As long as they're enrolled, yes.
Okay. And then my last question, do they all have to be individually enrolled as provider type 93 prior to the group enrollment, or does provider type 20 and provider type 14 suffice?
So provider type 14 and 20, as long as they're on that grid of who can link, and I should go back to that here. Well, I'll go back to that at the end, so I don't get distracted here. But yeah, we can cover that. We can cover that at the end. Okay, does that work for you?
Yes, ma'am.
And I'm
Sorry, I
not
just
sure.
wanted to...
Heather, if you're the one that put it in the chat, because we're going to address the Q&A at the very end, but specific to those 14s, and Susan will go back to that slide once more before the end of the training, but LMSW interns, so any QMHPs that are interns cannot link to the 93s.
Unless they're
Okay,
duly
but-
licensed.
Okay, and the question that does the clinical supervisor need to be a CADC or LADC if they are an LCSW? That was my question as well.
Thank you. Those are great questions. We will cover those when we get through with the live demo.
Okay, perfect. Thank you.
You're welcome. Thank you. Great questions. Okay,
Sorry,
back to
bye.
no, you're good. Back to the provider identification section here. Again, information should look pretty familiar to you. The change that you're going to notice is you see the supervisor panel down here. I am enrolling an intern, if you remember. So my supervisor information does need to be entered for this individual. So you'll have to enter that enrolled clinical supervisor for the agency. So keep in mind this clinical supervisor information that you're entering is the agency supervisor, not the board supervisor. It has to be for the agency. And then you'll fill out the required fields with the red asterisk and then just do add or save if you're modifying it. So you'll be able to see that line item here. If they're not enrolled, you will get an error saying that they're not enrolled, and you would need to do that clinical supervisor application first. And so those are the biggest changes that you're going to see on the actual online application. So I'm going to go ahead and cancel out of this. Unless there's anything that somebody wants me to go back over for the online application, can you please go ahead and raise your hand now and let me know what part you need clarified or you need? It looks like Sue, you have your hand raised. Would you be able to come off mute and ask your question? Okay. Maybe you didn't mean to put your hand up, so I'm going to go ahead and move on. So getting out of the application here, I'm going to go back and show you that linkage slide again, so we can kind of rest on that for a few minutes. Because I'm sure that there's related to this. So before I give you the contact information or we go through the provider survey at the end of the training here, I think we should go ahead and go through the question slide. So Alyssa, if you want to start going through those, we can start addressing those.
Perfect. So I have Heather who had asked it verbally, but we can address it once more. Can you check all ASAM level of cares in the PT 93 Specialty 707 checklist? Yes, you would want to put in all the specialties and identify as each subspecialty within that group 93 707 specialty. The subspecialties will be added.
Would it be helpful if I brought up the group application section again?
No, I'm okay. I understand
Okay.
completely and appreciate you guys very much.
Absolutely.
Next question is, how would a contractor APN be addressed in 93 Specialty 707?
Okay, so if a contract is this person eligible for enrollment under Nevada Medicaid's guidelines? Because I don't know that we have an APN provider type or specialty.
If
you don't see it
whoever
here-
put that in the chat, if you wanted to clarify your question off mute.
Sue doesn't have audio, so she's doing in the Q&A.
Thank you, Heather.
So I know that APN was entered in the Q&A. However, PT24 is APRN. Those are individual provider type 24s who are able to link to a PT93 group, and bolded means that they can also be the clinical supervisor of that PT93 group. The next question is, does the clinical supervisor need to be a CADC or LADC if they are an LCSW?
They would need to be enrolled as one of these provider types listed on this slide in order to be able to link to the 93 group. So if they need to be duly licensed or duly certified, however it is, they can enroll as multiple provider types under their individual NPI. So if they're currently enrolled as a QMHP under provider type 14, they can also enroll as a, let's just say, a 701 under provider type 93. We will allow that. It is a new application. That new enrollment would be the one that you link to your provider type 93 group.
And then I think this is coming from, oh, sorry, Beth, go ahead.
Okay, I was like, I can't find the raise hand function. If I can just elaborate on that question. So the clinical supervisor if they're an LCSW, they do not need to be duly licensed as a CADC or LADC as long as they have the training to be able to treat the SUT population. So I hope that's helpful.
I thought it was an intern question, so I just want to make sure that we clarify if it's an intern LSW.
Oh, good thought. Yes. So if it's an intern, to piggyback off of Susan, sorry, if the question is, if you're asking about a CSWI or an clinical social work intern, then yes, the intern would need to be duly licensed and pursuing their, the only interns allowed in PT93 is the CADC, the LCADCI. So if it's an intern, they would want to pursue dual licensure. If it's fully licensed LCSW and they have the experience to be able to treat substance use treatment, then no, they would not need to be duly licensed.
Thank you. Question answered.
So I think this is still Sue's question, the contractor APN. So we don't have an APN, it's APRN PT24. If they're already enrolled with Medicaid and have their own practice and work for the group, if they are already enrolled as an individual PT24 advanced practice registered nurse, then all they need to do is link to the group.
And just for clarification purposes, linkage can happen two different ways. You can link an individual to the group using the individual EVS account for that individual and attaching that group and PI in that very first section where you answer, yes, do I want to be linked to a group, and enter in that group and PI and the starting date there. Or you can link under the provider type 93 group EVS account once everybody's enrolled, and adding that individual's name to the associated provider section and have that associated provider signature form. So there's a couple of ways you can link already enrolled individuals, or if you're linking after the fact, you can do that two different ways. Any other questions, Alyssa?
That does conclude the questions from providers in the chat. The one that asked about APN was removed, but I do see that Beth's got added in there. If you could please clarify what that is, if that question still stands. I'm not sure if that's from Sue, who does not have audio, but if what you mean is APRN enrolled as a PT24 with Nevada Medicaid, and they are already enrolled, then they can link to the PT93 group. I do not see any additional questions in the Q&A.
All right. Well, if anything happens to come in while we're sharing the contact information for Nevada Medicaid, we can address those after. So let me share that contact information with you. We have two email addresses up here on the screen. One is to reach our Nevada Provider Training inbox, or if you have mine already, you can certainly email me as well. Or you can reach out to the DHCFP, which would be Beth Scott, at the behavioralhealth@dhcfp.nv.gov. So those are two resources for you in case you have questions or are having trouble. Either one of us could be able to help you out there. And I'll just pause here for just a moment just because we can't post these in the chat. So if anybody needs to write them down, please take a moment to do so. Okay, and last but not least, before leaving today's training, if there are no other questions, Alyssa, we're good?
Yep, that looks like all the questions in the Q&A.
Perfect. Can you please go ahead and launch that last provider survey for our audience here today? And then if you could take a moment to answer the questions. There are 6 very brief questions asking for feedback from today's training, any future trainings or information that you would like to see covered in the future, and any feedback that you might have to help us improve our training program here. And then once you get done taking that, you are welcome to leave the training. If you have no further questions, we will hang out for a couple of minutes to answer any questions. If you want to come off of mute, you certainly may do so. Again, I appreciate everybody being here. I know how valuable everybody's time is. So thank you so much for attending today. And if you do feel like you want to attend additional future workshops, please go ahead and enroll in those in the Absorb training registration website. We are looking forward to working together on this process and getting everybody transitioned as seamlessly as possible.